Good afternoon, everyone. Good afternoon, and thank you for joining the TTI True Tempers International Health Show. My name is Charlene, and I have my co-host with me.
Good afternoon, everybody. My name is Linda Salmula. Good to see you all again.
Thank you, Linda. It's a pleasure to be hosting with Linda. And today we have our speaker, Dr. Travis Tramel, who spoke with us sometime last year. I'm not sure when. Maybe Dr. Travis can remember. Um, Talking about oral health. Dr. Travis, is he there to wave to
There we
everybody?
go. Hey, good afternoon, good morning, good afternoon, good evening to all of those who are around.
Oh, thank you, Dr. Travis. So we do thank you for joining us, and thank you those who's tuning in on Zoom and on YouTube. Hello, Sonia, on Zoom and YouTube, and we thank you for joining us once again um, on this health talk, where we will discuss about oral health and how important it is to look after within in our mouth. So before we start, we're going to go straight in with Dr. Travis. But before we start, I'm just going to share my screen and we're just going to go through the promos very quickly. Okay, so we are still on our Fearfully and Wonderfully Made, Know Your Body. It may seem like a long um, season 2 family health show, but God has made us so beautifully, wonderfully, that there is a whole there's so many things to talk about when it comes to the human body, and we haven't even finished. Next week we will have Louise Reed, and she will talk to us about vitamin K. We haven't even touched on not even a half of the vitamins and even the minerals, so we still have a good way to go. So Louise next week will be talking to us about vitamin K, the K factor. Today we have, as you've heard, Dr. Travis Tramel, Oral Health and Beyond. Are you in good hands when it comes to hygiene within our mouths? Are you in good hands? So before we start, we are going to have our disclaimer. Linda, are you able to read this for me, please?
Yes, sure, not a problem. So this is our disclaimer, and it reads as follows. Only a physician can diagnose, treat, and prescribe for illness or disease. Any information that is disclosed or discussed at the TTI Zoom talk show is for educational and informational purposes only. We encourage you to please continue to seek professional medical advice from your general practitioner regarding any illness or disease that you may be suffering from.
Thank you, Linda. Okay, so on the screen, we have our TTI Telegram groups, and we have our spiritual health men's wellness group and a women's wellness group. And on these groups, the spiritual one where we have words of encouragement, prayer requests, devotions, where we all come together, and it's about our the spiritual aspect, spiritual life, spiritual health. On there we have even remnant connections taken by Chris in conjunction with TTI, where we're going through the book of Great Controversy, and we touched on chapter 4 yesterday. So please join the Bible study. I would say the study on a Friday evening at 7. And then on the men's and the women's health group is where we just talk about health. Anyone that may have any issues when it comes to health or needs any advice, this is where we'll discuss on these platforms. So please take note for those who are on YouTube. The URL is there. Please ensure that you do have Telegram downloaded on your device. On Zoom, for those who are new, we do thank you for joining us, and one of us will be able to place the link in the chat. Okay, so this is the 29th of August to the 4th of September. We have Come Apart and Rest a While. And this is in conjunction with many ministries within the British Isles, within the UK. As you can see, that's just a fraction of them at the bottom, where we have Andrea Crawford, Alvin, Lucille, Joanna, Pastor Conrad Vine, Joanna Dan, Jackie Brown, Pastor Sam, and there's many, many more we all come together to hold this conference. And we have workshops happening throughout the week, such as your mind and disease, detox and therapies. There'll be consultations, herbs in your practice, country living, and physiotherapy, and many more, many, many more. So please, the telephone number is there. If you would like to book or for more information, please contact the telephone number that you see on the screen. There's only a few places left, as they're all booking up. So please, if you would like to come, don't delay or hesitate. If you want to come, please book, because they are booking up quite fast. Linda, the 10-day.
Yes, so we have the 10-day colon and liver detox that will be taking place from the 17th to the 26th of April. And what we're going to be doing here is teaching and using juices and raw nutrition. Oh, excuse me there. And raw nutrition. And what will be happening at that time is there'll be lessons on how to make the digestive system more effective, maintaining regularity and preventing constipation, how juicing and raw nutrition helps you increase your energy, helps increase the absorption of vitamins and nutrients in your body, how it can help kickstart weight loss, which is always a good thing. How it can also help support the liver. We know how important our liver is to our health, and therefore it's also important that we understand how to take care of it as well, so that it can also do its part in serving us well. We'll also be looking at the increase of bile flow to the liver and what all of these things mean in relation to the use of juices and raw nutrition. So we've got the price details there with regards to the detox packs, how much they will actually cost us. And for more information that you might need and additional questions that you might have, we encourage you to please contact Louise at Mercy's Door Health Ministry. And the number over there is on the screen. Please note that there are only 30 places available. There are only 30 places available. So make the call, book yourself a spot, and you'll definitely not regret it.
Thank you, Linda.
So we'd also just like to thank you all for the support that you have been giving to the TTI ministry over this course of time since the ministry began. We'd like to thank you for your prayers. We'd like to thank you for your attendance at these various sessions, because without you here, there wouldn't really be these Zoom platforms that are occurring in this YouTube ministry that is going on as well, to teach more and to get more speakers to actually help all of us. So the engagements that we get from all of you are really, really, really important. And we want to thank you, and especially for that presence and for those prayers, because we know that that is what keeps this ministry afloat. For those who would also like to support financially, we thank those that have been supporting all along. And if there are any more that probably still want to support this ministry financially to be able to do the work that it does, please can you just take a screenshot of the screen that you see on your side, and if you could just then make those transfers to that account that has been listed there, we would be grateful. And wherever you take from, I pray sincerely that God may give an increase. Thank you very much for all your support.
Thank you, Linda. Thank you so much. So without further ado, we're going to hand it over straight to Dr. Travis. So Dr. Travis, it's all yours. Thank you.
Wow. Because again, good morning, good afternoon, and good evening to those who are around. And we thank God for these platforms that are allowing many of us to come together who wouldn't normally be in rooms together. And it's definitely helping defray the expenses and the travel cost and everything that is going on. And so with all of that being said, let's pray real quick, and then we're going to jump right in. Father God, we just thank you so much for being with us today. God, our minds, our thoughts, and our prayers, Lord, as we are lifting up to you everything that we have to present to you, Lord, ourselves. And Lord, may the words that I speak, Lord, may they not be words of my own, but words that are flying through you, through me, because, Lord, you are the ultimate reason why we are here. And that's to seek and to serve those. But we also must take care of the temple that you've blessed us with, that you've given us, Lord. And through life's challenges and trials, Lord, some of our bodies have been broken. But Lord, we know that you're still the ultimate physician. So Lord, bless us now and keep us. Watch over us, protect us, and give us words that we can use that we can help and serve others with, Lord. Strengthen us and bless those who are on the line, Lord, and those that are still coming. Be with them all and be with their families, and help us to continue to serve you daily. And this is my prayer in your worthy name we pray. Amen. All right. Thank you so much again for allowing me to come and sit with you on your platform. And it's definitely been a blessing. And as I told the host and the co-host, thank you, Sharon, again for inviting me. And through life's challenges, I'm here. And praise God for that. And today, as we learn about your oral health, are you in good hands? It's going to be a little bit of repeat for some, and it's going to be enlightening for others. But just to know that oral health just not involves just every time I take a bite and I eat and I can talk. But we're going to see how simply your oral health can get out of shape. And our motto for today is going to be check yourself before you wreck yourself. All right, here we go. I always got to start off with my 3 John 1:2. Beloved, I pray that you may prosper in all things and be in good health, just as your soul prospers. Why? Because we're always in the word and we're always reading. How do I gain more knowledge? How do I do this? But the knowledge you're going to gain today is going to allow you to be able to save yourself, or at least being able to find issues before they get out of control. And we want to make sure that your theme that you guys have been following, fearfully and wonderfully made, know your body. Why? Because you need to know when things don't feel right, don't look right. Nobody wants to wake up in the dark and go to bed in the dark and never know what they really look like, right? So you want to know what you're in for, what you look like, you know, and they call it the naked truth, you know, understanding that when you are fearfully and wonderfully made, then it's our job to keep it up and to sustain it and to keep it moving. So as we move into our oral health theme, what is our oral health? Oral health is the critical to our general health and well-being. Good oral health enables us to what? Eat properly. You got a toothache, you're not going to be eating properly. You're going to switch sides, right? So that's why you got 2 sides to everything. You got 2 hands, 2 arms, 2 legs, you know, to walk balanced, to eat balanced. You got to have both sides of your teeth working. But if you got one half that's not working and you're using the other half, guess what you're going to end up doing? You're going to end up breaking that side down as well until we go and properly take care of that other side. So we want to work productively. If you got a toothache, do you think you're thinking about somebody's job or writing a dissertation paper or performing your work? No, because that tooth may be hurting you. You may have a migraine. It might be a sinus infection. What about the kids going to school, ready to focus, with tooth cavities all over the place. That's bacteria running around in the system. You can't focus on learning when your mouth is in pain. And also, we want to feel good about our appearance and enjoy life. That's what we look at when we're talking about oral health. It is also the gateway to the rest of the body. It provides clues about our overall health. And it sometimes is the first place where we actually see signs and symptoms of other serious diseases, such as diabetes. How do you know that? Well, we might start seeing you have dry mouth. We might start seeing some little rashes in your mouth, ulcers. And also heart disease are noticed, bleeding gums. All of those things make up our oral health. So what is our oral health? It refers to the health of the teeth, the gums, and the whole oral facial system that allows us to what? Smile. Because everything got to work together. Speak. I do another presentation just on speaking. Why? When you got a little kids who are learning to speak, but yet they don't have their teeth in the mouth, so all they do is babble. You know, just as we get older and we start losing our teeth in the front, you know, some of the words that you used to perform or say, you can no longer say those anymore. And we already talked about chewing. We need our teeth to chew. And I always say, your teeth is an addition and a subtraction. So it's all about math. Either we're going to keep what we have over a period of time, some of them get subtracted, meaning extractions. So that means we need to add more, put in a bridge, put in an implant, put in a partial, and God forbid, we got to put in a denture. So as we see, some of the most common diseases that impact our oral health includes cavities, which is tooth decay, the gum disease, periodontal disease, or oral cancers. And that's where we're going to go. That's our oral health and beyond. So we're going to start from basics. Flossing. You got to floss at least once a day. It helps remove food particles and plaque between the teeth along the gum line, and that your toothbrush can't quite reach. So we're going to watch a quick video on how to properly floss. So I'm taking everybody and we're going to build you up throughout this whole presentation.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about an inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
All right. So we got that one down. So we flossed. Now we're going to brush. Brushing after meals help remove food debris and plaque trapped between the teeth and gums. Don't forget to include your tongue. The bacteria loves to hide there. Everybody says, I brush every day. But are we brushing correctly? That's the thing that we always look at. Because, hey, let's jump into the video. And then we're going to see, are you brushing correctly?
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal. and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Got it. So we learn to floss first, then we learn to brush second. Very important, because when we floss the food out from between the teeth, then we're going to actually brush it away. And what's the angle? Was it flat onto the teeth, or did she say brush at a 45-degree angle up? So we want to take that brush and go 45-degree angle up, because we're going to learn that there's a little space between your tooth and gum. It's called the sulcus. It's a little space where when you're chewing your food, there's ligaments in there that help to keep your gums going back and forth. It's almost like your car, and you have shocks in your car. So when I don't know where you are in the world, but some people have good roads, some people have bad roads, potholes in the roads, bumps in the roads. So those shocks help to give you absorb some of that pressure. So when you hit that pothole, it's like boom, So when you're chewing your food and that food is so good and you're chewing real fast, those ligaments actually help to keep the brunt off of your teeth. So you're not smacking your teeth together when you're trying to chew your food. So those periodontal ligaments give you that buoyancy you need, and then you get to swish that stuff out. So after we floss out, brush away, some of the stuff still didn't get out. So now we're going to use some mouth rinse. Which mouth rinse is better than some? Water. I don't know. To me, there is no right or wrong reason or rinse you can use, but there are some good ones out there. And I like to use the herbal ones as well that don't have the alcohol in them, because some people say the alcohol is what helps kill the bacteria. Okay, great, if that's your philosophy. But also, if you're on medications for diabetes and high blood pressure and different things like that, if you got an alcoholic mouth rinse, then that also causes dehydration or dry mouth. And we don't want to incur that. You don't want two negatives that come out. It doesn't make it positive at all. So we want to make sure using a mouthwash can help reduce plaque and can remove the remaining food particles that the brushing and flossing missed. All right, so now as we move into our diseases, we're going to find out that dental plaque is very sticky. It's a colorless, pale yellow film that is constantly forming on your teeth. So when saliva, food, or food combines, you got to excuse me, this week has been rough on my voice here, which as soon as you eat, food has sugar and you got liquid, it's going to form plaque, which contains a bacteria. That bacteria is going to stay in your teeth and along your gum lines, as you can see from the picture to the right. It's very, if you're not talking to a person long and you don't see it, and I always say, if your fingers are, drink some water here real quick. If your hands are clean, you can take your fingernail and you can actually scrape your teeth. Sometimes you can see that little pale yellowish bacteria come off of your teeth. So therefore, more people says, well, if I'm going to do that, then I might as well get a medium or hard toothbrush. I say it's fine. But the problem is, if you're out working in your yard and you were sweating and you really created a smell on your body, odor, do you go get a Brillo pad and go bathe with a Brillo pad? No, because you still got your natural skin there, which is very sensitive. Just like your teeth and your gums. You're going to touch your gums. Remember, if you're turning up that brush to a 45-degree angle, you're going to be touching the gums. So you don't want anything hard touching the gums, because what is it going to do? You're going to start forcing the gums to actually recede. And some of you have been to the dental office and they've told me you have receding gums. What does that mean? That's when the gum starts to recede away from the gum line that it was normally at. And what's underneath the gums? Your nerves, the roots of your teeth. That's where those nerves hide. And if you ever drink something cold or hot and all of a sudden air between your teeth and you feel that sensitivity, that's what happens when your gums are receding, because they're now no longer protecting those roots, which are housing those nerves. So we want to make sure the first sign is dental plaque. The first stage is dental plaque. So if we keep dental plaque under control, everything else will actually subside. So when plaque has been ignored, those sleepless, those nights that you were too tired from working and I'll brush my teeth tomorrow. I didn't eat much today. You know, now that plaque begins to build up. That build up becomes gingivitis. And I always ask this question here. Anybody in this room or on this line have a disease? And usually when I'm in a public room, not one hand goes up. Nobody's going to admit they have a disease, right? But guess what the first sentence says? Gingivitis. It is the mildest form of what? Periodontal disease. It causes the gums to become red, swollen, and bleed easily. How many of you have ever flossed or brushed, spit into the sink, and there was blood in the sink? Yeah. You can type it in the chat, but you know when you're home, you spit and there's blood in the sink. There is usually little or no discomfort at this stage. Gingivitis is often caused by inadequate oral hygiene. It's the proper brushing, the proper flossing. Remember she said, take that floss, go between the teeth. She said, run it in the gums. No, you gently place it between the tooth and the gum, gently rubbing against the tooth. Why? Because your toothbrush does not get that area. Your toothbrush is not curved, it's flat. So your teeth are not flat. Look at your teeth, they're oval shaped. Okay, they're oval shaped. So what happens to the ridge of the tooth that you don't get? That's why toothbrushing and flossing goes hand in hand. Gingivitis is reversible with professional treatment and good oral home care. So now, plaque turns into gingivitis. Gingivitis, reversible. Once it's been ignored, guess what? It gets harder because your mouth dries out at night when you sleep. Your body's at 98 degrees. So it is harboring bacteria. And if you mouth breathe, it's even worse because you're adding oxygen to create that perfect storm. Now you're drying it out even more, and now more bacteria can form. I told you, dentistry is nothing but math. Because teeth tartar, also called what? Dental calculus. Calculus, math, is crusty deposits, can trap stains. It adds stains onto the teeth and causes discoloration. So if you've seen people, you've seen some like the picture to the right that have had those types of gums in the teeth, and you can see the gums have receded away from the gum line. You can't really see the root because the tartar is covering it and the gum lines are red, infectious, and it's steadily moving. Why? Bacteria. It's an acid. It eats. It kills. It breaks down. So you can see tartar creates a strong bond that can only be removed by a dental professional. Why? If you try to go and remove that tartar from those teeth, guess what you're going to end up doing? Causing more harm than good. The tartar formation may only make it more difficult to remove the new plaque and the bacteria. As we're progressing, we're building here. Untreated gingivitis can now cause or lead to advance to periodontitis. Perio is now in the bone, is dental, teeth. The bone around the teeth is now reducing. And sometimes with the time, the plaque can spread and grow below the gum line. Then toxins are produced by the bacteria in the plaque, irritates the gums, it moves the gums away. That's what we call periodontal pockets. Okay, once we get those periodontal pockets, then now more food can get trapped underneath the gums. And now it's going straight for the bone. And then when we get to the bone, Now we can start getting our tooth to become loose. And sometimes the teeth actually starts erupting. So as we're getting ready, excuse me, but we're seeing how everything is actually building up. Once we get there, now our gums are open. Now we're talking about periodontal disease and how that looks, because we want to make sure that our gums stay healthy. We're taking a periodontal probe and we're checking for your pocket depths. How much of your gums have actually moved away from the tooth? So we want healthy gums. That's in the 1 to 3 millimeter range. Gingivitis is still in the 1 to 3 millimeter range. When we move to stage 3, periodontitis, that's into the 4, 5, 6 millimeter range. So you've heard people call, the hygienist calls, you got a 2, 3, 4 on that tooth. 3, 3, 3, 2, 4, 4, 6, 7, 8 is usually in the posterior teeth. Why? Because that's where we do the most chewing at. And especially if you're eating any meat or anything that causes you to hit pound, 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 pound more often, you start seeing more areas that are actually forming that bacteria getting down. As you can see, the gums are pulling away, it's getting down into the bone, and all of a sudden we end up in stage 4. Because it's hard for you to clean that area. There is no herb, no vitamin that you can take that will actually kill that. So that is seek your professional, your dental professional, to make sure they get underneath the gums and get that area cleaned. So as we talked about periodontitis, is where the gums separate from the tooth. They form those pockets. We talked about that sulcus. Remember when she said turn the toothbrush up, 45-degree angle up for the upper teeth, 45-degree angle down on the lower teeth, because it's that spaces between the tooth and the gum that becomes infected. And so we want to make sure that we keep that area nice and clean, because you can see how that disease started from just eating simple foods that had some sugar in it. It created bacteria. That bacteria has continued to grow, form on the teeth, and all of a sudden, now we got issues. As the disease progresses, the pockets deepen, the more gum tissue in the bones are destroyed. Often this destructive process has a very mild symptom. Eventually, the teeth become loose and they may have to be removed. So this is very fitting that we moved into the month of April, second day of April. And what is it called? April is known as Oral Cancer Awareness Month. Remember when I started, I said, check yourself before you wreck yourself. Because how many times do we brush our teeth and we don't even look at our teeth when we're brushing them? To making sure we're doing it properly, to make sure that we don't have any signs or symptoms that are forming in our mouth that wasn't there last week, that we don't have an ulcer, that we don't have a laceration, or we don't have a lump or a bump growing on our gums or on our cheeks or on our tongue. Okay, so we're going to learn how to check ourselves here, and we're going to go through this process of learning about oral cancer. So you can see we've gone through the disease process. Now we're at the pinnacle, oral cancer. And what does it look like and how we can be better informed? What is cancer? Oral cancer, it develops on the tongue, the tissue lining of the mouth and gums, under the tongue, at the base of the tongue, and the area of the throat and the back of the mouth. So someone is talking about some tonsil stones there. And we're going to get into different ones there, stones. I can talk about the salivary stones, when your salivary ducts have stopped producing or bacteria builds up on them, a sore throat, or strep throat, or your salivary ducts have been clogged. Why? Because we got bacteria that's clogging the ducts. So your bacteria is supposed to flow. So when it doesn't flow properly, something blocks it. It's still flowing, but if it's being blocked, guess what it does? It creates a stone. It hardens. There's calcium in there because it's calcium. That's how you get a stone. The calcium is being backed up. calcium solidifies. Just like you got pancreatic stones, kidney stones, it's not flowing properly. The blood flow is not going through. The calcium is building up, excuse me. And so therefore, the normal bacterial flow is not happening as it should. So therefore, those stones cause issues, and we got to get them out. So you're going to see salivary stones in the cheek, it backs up, and you can end up with cancer in that area. Symptoms. Signs and symptoms of mouth cancer may include a lip or mouth sore that doesn't heal, a white or reddish patch on the inside of the mouth. Remember that, a white or reddish patch on the inside of your mouth. Loose teeth. Well, the tooth wasn't loose before. What's going on in my mouth? It's happening all over the place. And especially if it's a loose one over here, a loose one over there, and they're like in different areas. A growth or a lump inside your mouth. Yes, it does have a bad odor. But you gotta have it's a growth or a lump inside your mouth. But if you never look in your mouth, you never know what's abnormal. You may have a mouth pain. You could have an ear pain. Why? Because the head and the neck is all one. Inside the top of the mouth, we have what we call sinus infection or sinuses. And your upper molars are usually inside the sinus cavity. And if there's a sinus infection, guess what? It's happening to the tooth. You also got here, ear, nose, and mouth doc, So it could be an earache. And when they talk about the tonsils, you're talking about difficult or painful in swallowing. Because usually when we're in the schools, excuse me, we're looking at the kids' tonsils because they can be red and inflamed. And you got this big white patch sitting around them. And it's just letting you know how much bacteria is on them and they're inflamed. And usually there's an herbal rinse we will get. One that has some peppermint, some eucalyptus, and some thyme that's in there to try to numb them a little bit that we use just to start gargling with. And sometimes I always say, it doesn't hurt to just swallow just a little bit, just to numb that area up. And we're going to talk about some different herbs that you can use as well to help with your dental pains and aches. But those symptoms are very crucial to understanding where we are. And we're talking about a lip or mouth sore that doesn't heal right away. And they're usually saying anywhere longer than 2 to 3 weeks, go get it checked. Check yourself before you wreck yourself. Several types of malignant cancers occur in the mouth and throat. So we get squamous cell carcinomas is by far the most common type, accounting for more than 90% of all cancers. Squamous, that means they're flat. These cancers start in the squamous cells, which forms in the surface of much of the lining of the mouth or the pharynx, throat. They can invade deeper layers before the squamous layer. So we're just talking about the squamous layers of the tissue, the top layer. That's the layer that you can see. It's always flattened when it starts. That's why when it's flattened, it's just like the iceberg, right? You see the iceberg. It's just a little bit on the top of the ocean. But then understanding, just like squamous cells, they said they can invade where? Deeper layers below the squamous layer. Just like that iceberg, it can be 3 to 5 times deeper because you only see it on the top. Oh, it's just a little flat surface, nothing big. It's growing underneath the skin or underneath the squamous cell layers, which can be invading other parts of your body. It also talks about other less common cancers of the mouth and the throat. They include tumors of the minor salivary glands. We're talking about the salivary glands in here. They call adenosarcomas, my throat, adenocarcinomas, and lymphomas, tumors of the lymph nodes. Cancers of the mouth and the throat do not always metastasize. They do not always spread to other areas. Okay? And it can just be, sometimes they'll use a proton. Boom, hit it right where it's at. It's not metastasized, so it's not in any other organs or tissue. But those that do usually spread first to the lymph nodes of the neck, because they'll spread here. But guess what? Your lymph nodes go throughout your body. You got lymphs in your, you got nodes in your neck, you got your head, you got your rest of your arms, and they may spread. So that's why we always want to check those areas prior to. Hey, anything small, we want to go get it checked. We don't want to sit there and, try to find all the remedies in the world to try to combat it. Well, this doesn't look right. After 2 weeks, go. It's not getting better. It might be getting larger. But how do you know unless you're checking yourself, right? So cancers of the mouth and the throat occur in twice as many men as women. Men and women. Why? Because men, we don't usually check ourselves. We let it ride. Oh, we try to combat it. We'll hide it. And they also carry in any age group, but mostly they've seen them occurring in 45 years and older. The incident rates of mouth and throat cancers vary widely from country to country, of course. These variations are due to differences in risk factors and exposures. Because it's not always manifested itself. You got laid back areas, relaxing, islands, nice sun. You got other areas that are colder climates. Those who are getting sun, those who are not. Those who have vitamin D deficiency, and that's what you're getting ready to study on vitamin K as well. All of those are beneficials and understanding your body and making sure you check yourself. So risk factors that increase your risk for mouth cancer, because I have no idea who's all on our line, so I have to include everything. So those who use tobacco, any kind, cigarettes, cigars, pipes, chewing tobacco, snuff, and among others, because now we got the vapes, excuse me, which we don't know what the beneficial factors are or what the contributing factors are, or what the chemicals are that are in the vapes, or a long time study to know what those chemicals are and what they're going to do to your system. Heavy alcohol use, excessive sun exposure to your lips, because sun does what? If you're not drinking your water, then you're not hydrated. And it says excessive sun exposure can also cause you skin cancer, right there on your lip, because you're not moisturized. So we always say, hey, put on a lip, sunscreen to try to protect your skin as much as possible. Or a sexually transmitted virus called HPV, human papillomavirus virus. Or we got a weakened immune system. And so right now, while we are claiming to be healthy, we need to make sure we are above healthy and doing all we can to stay on it. It's a job. Just like you spend your 8 hours at your regular job, 8 hours, 10 hours, 12 hours, however long you work, and you're trying to keep that up, you have to be excessively aggressive in making sure your immune system stays up. Staying on top of it, eating correctly, going to bed on time, getting your daily exercise, drinking your water, resting, trusting in higher powers. So all of that actually helps to build your immune system. And getting your proper air as well. Making sure you're airing out your house and things like that. Those are all risk factors. So we talked about those, but the one I wanted to really prove and give you is the last one on this list says, see your dentist regularly. See your dentist regularly. Why? Because they can see things that you can't see. You can't look all the way through your mouth, but at least they can. And they're going to do that, what we call that routine dental exam. But look at my whole mouth. Anything that you feel that's abnormal, It may indicate mouth cancer or precancerous changes. So who can be affected by mouth cancer? Anybody. Anybody can be affected, whether they have their teeth or some teeth that they bought. You can still get mouth cancer because it's the tissue of the mouth. As I said, men over the age of 40. Research has shown now that mouth cancer is becoming more common in younger patients. Stress. There are more than 640,000 cases of mouth cancer diagnosed each year worldwide. 640,000. The 11th most common cancer in the US alone is for over 43,000 that's diagnosed. That's those who are getting checked. Thank you there, Ms. Louise. She's talking about, I just ran and got my floss and started flossing her teeth. Because if you don't floss the ones, as a matter of fact, my slogan as well, only floss the ones you want to keep. Because if you don't floss them, the bacteria is going to build up and we will start subtracting and brushing. So do people die from mouth cancer? Absolutely. So over 650,000 new cases of cancer every year in the oral cavity and the pharynx. So that's the mouth and the throat. And half of them die. Wow, that's a hard number there. 330,000 deaths. And this next sentence, many of these deaths could have been prevented if the cancer was diagnosed early enough. Many of these deaths could have been prevented if the cancer was diagnosed early enough. Check yourself, people, before we wreck ourselves and our families. As it is, people with mouth cancer are more likely to die than those having cervical cancer or melanoma cancer. Why? Because we don't check ourselves. The dentist is the last place we want to be. We'll go to our physicians. We'll go get those 6-month treatment sessions, even though they only spend 5 minutes with us. Oh, you're good. Oh, your blood work looks fine. But more people will die from mouth cancers than those having cervical cancer or melanoma cancer. Prevention. Prevention is key. So how can this mouth cancer be detected early? Mouth cancer can be spotted in its early stages by your dental team during a thorough mouth exam. Like we said, if mouth cancer is diagnosed early, then the chances of a cure are good. But most times, you get there too late. Time is of essence. You can't be getting ready. You got to be ready. Why? Because I'm on it daily. I'm looking. And I'm going to show you how to do that as well. So is there anything I can do at home? Be aware of what's going on in your mouth. Examine yourself regularly. Just like women do their breast exams, men do theirs, prostate exams. But we want to make sure ulcers that do not heal within 3 weeks. Any unusual red or white patches. Any lumps in our necks, in our jawline. Persistent hoarseness. Trust me, I told you, the devil tried to hit me up this week and give me a sore throat or something. And I woke up this morning and here's my voice. So I'm like, Lord, only you know somebody needed to hear this. And the exact same thing I talk about is what I end up with. But it's not persistent. It just happened this morning and here we are. But I got my water. I had a tea I was drinking earlier, but I said, it's for God that we're going to continue through this presentation, because I always say every presentation is a divine intervention for somebody. But always check your dental team. Get your 6 months in or 3 months, depending on what they told you. Sometimes we need to see them a little bit more regularly. But we want to make sure that what you're feeling, that is nothing serious, or that you've done all you could do to go get it examined. But an early diagnosis could, guess what? Save your life. So here we go. We're going to check ourselves, right? So we're seeing first picture, the hard palate. We can get a hard palate cancers. We're also looking at the soft palate. That's in the back of the throat, by your tonsil area. That's all soft tissue back there. You can actually take your tongue and run it from the front of your mouth. That's hard. You usually can't get it, your tongue back to the soft palate area, but you might. I don't know, some people could. But that's in that back area. You're going to see underneath the tongue. That's what we call the ventral surface. That's because you can see all your nerves. When you're looking in that mirror, you can see your nerves running through there, all the way to the floor of the mouth. Then we want to also talk about your tongue. You see they grabbed a rag and they put, because you use your finger on your tongue, it's going to be slippery. It's going to slide. But you're using like a rag or something that's dry. Grab your tongue, pull it out as much as you can, turn it to the left, turn it to the right. And we're looking at the lateral borders of the tongue, making sure we don't have a white patch or anything red on your tongue. Then coming down to the second row, the mucosa and the gingiva. The gingiva is nothing but your gums. We want to make sure that they're looking good. I did have a person ask me, excuse me, well, my gums, African-American person, my gums are dark in certain areas. Should I be concerned about it? And I told them, I said, they're just dark. They're not white or red, right? I said, no, they're dark. I said, well, consider it a blessing then. They said, why is that? I said, because you're African-American. So therefore, your pigmentation actually came through your gum tissue as well, so you don't forget who you are. You know? And I said, no, that's just pigmentation. Dark spot, normally, if it's there, it's not red and it's not white, and we're not moving into any areas. Usually that's usually what it is. It's your pigmentation, your skin pigmentation coming through your tissue. We're also looking at the lip. Take your lip, and of course I don't have any gloves on. And so you want to take your lip and rub your finger across your whole lip, all the way through. And we want to make sure that there is no lumps, no bumps in those areas, okay? The buccal mucosa, the cheek. Please, can we be reminded why we have the white stuff in the two holes at the back of the throat? Yeah, well, white is usually bacteria, depending on what it is. I can't say where, but if it could be bacteria around your tonsil area as well, but the tonsil shouldn't have anything white. Usually if you gargle, or it could be candida, yeast infection as well, an overgrowth of yeast. So a lot of breads, a lot of sugar can also cause yeast infection in the mouth, which we call candida, which would also put white on your tongue that you can't get off. So basically we need to do a candida check and check those levels and making sure that it's not something more serious than it is. But those are some of the things that you can do. A simple mouth rinse or an herbal mouth rinse can help you actually get rid of that. Or you can take some candida pills to actually help break that down as well. That's off your tongue and your throat area. But we talked about your lip. We talked about the mucosa, buccal mucosa, the cheek. We want to pull that cheek out. We want to look at that area as well. And we're talking about the vestibule. When you pull down your lower lip and you're looking at that area, you want to make sure everything looks well. Okay? It looks symmetry. What you have on one side, you also have on the other side. That's checking yourself daily, weekly, vice versa. So now that I've gone through that check at home, What does the full checkup look like? That's when the dentist goes look into your mouth. He looks at your tongue. He's going to do the exact same thing I just showed you how to do at home. It'll be examined with the help of a small mirror because you can't see in the back of your area, your back of your tongue. You want to make sure the back of your throat that you can see. But we want to make sure that we're taking care of those areas. And so the dentist can look even better than you can. That's why it's always important to have second eyes looking at your mouth. The examination will also look at your neck and underneath your jaw. When he pulls up your tongue, he wants to look underneath those areas and making sure there's no abnormalities underneath there. And your dentist should, check this out, carry this through, making sure that this is a part of your regular dental check. It's one thing to be looking for cavities and broken teeth and gum disease, but we also want to look at cancer checkups as well. Looking at the head, the neck, and your cheeks, your jawline, making sure everything is good. And so we always want to make sure our dental team is a part of us. They're also a part of our exams. We're also a part of our medical area because our bodies are what? Fearfully and wonderfully made. They're all one. But we got to make sure that we can actually check ourselves before we wreck ourselves. So remember I said, we've been giving a temple. Our bodies is in our hands. Back to our of the opening. Your mouth, is it in good hands? Your mouth, is it in good hands? So what happens if my dentist finds a problem? If they find something unusual, normally they will refer you to a consultant at a hospital or an oncologist, hey, who will carry out a thorough examination of your mouth and throat. May go to an ENT. A small sample of the cells may be gathered from an area, which they call as a biopsy. These cells will be examined under a microscope to see what is wrong. They take the little samples, or sometimes the dentist will take the samples nowadays, and he'll put another thing, and he'll send it off. And then at that point, if they see something serious, that's when he'll send you off. But in case that dentist does not have that capability, then they will send you to another physician who may be able to carry that test out for you. So what happens next? If the cells are cancerous, more tests will be carried out. These may be including a health check, blood tests, x-rays, and scans. These tests will decide the course of the treatment is needed. So can mouth cancer be cured? If the mouth cancer is what? Spotted early. The chances of a cure, a complete cure, are good. They're better. And that means that only a smaller area or the ulcer has a chance to be cured versus being, what's the other word? Metastasized. Metastasized meaning it has moved on. It's not longer just in one area, it's throughout the whole head and neck or vice versa. However, too many people come forward too late because they do not have regular mouth examinations. So as I told you, this whole thing is progressing. So now it is cancerous, and now we're living with the mouth cancer. Because some of us have had some family member or friend who has had some type of cancer, and they all move the same way. So now we're going to live with mouth cancer. It can be very difficult coping with the diagnosis of mouth cancer, both practically and emotionally. Why? Because if you got mouth cancer, what are you thinking now? Oh my goodness. All you see is signs and symptoms. Now we go to Dr. Google, find mouth cancers. What can I do? What can I live with? How does this work? What is my side effects going to be? What is my love life going to be? All this is going on in your head. Now the stress level is up. Now you just exacerbated the whole situation. So at first you're likely to feel very upset and frightened and confused. Man, how did this happen? Why me, Lord? You may also feel that things are out of control. It is very important to get the right information and support to help you along the process. Why? Because sometimes we got our own preconceived ideas. We always go left field. We always get to the finish line of, oh man, I'm about to die. And we only at stage 1, which can actually be reversed and taken care of. So it's always important to get the right information, get on the right train, and stay the course. Family and friends around you, letting them know what's going on. The recovery period can be very difficult at times for some mouth cancer patients. Because after the treatment, the patients may have problems with breathing, swallowing, drinking, and eating. Speech may also be affected and occasionally even lost. Sometimes, depending on the treatment, facial disfigurement can also occur. This can lead to other problems such as nutritional deficiency and depression. We got difficulties in communication, low self-esteem, social isolation, because I don't feel pretty anymore. I don't feel like hanging out with my family anymore. They're gonna think differently of me now. And the impact on the relationship is even worse. Because I put myself in self-isolation, I don't feel pretty anymore. I don't feel loved, or I don't want to show love anymore because they're gonna think of me differently. So that causes a lot of distress as the cancer itself. Mentally, a person has actually left the building. So the challenges of eating after the mouth cancer. Radiotherapy is no joke. It can affect your taste buds, meaning wipe them out. Anybody on the line who understands dry mouth, which is the term, is biological term is xerostomia, is very hard. You can't get, that's how you're trying to get some saliva, or you're constantly drinking water because your mouth is so parched, dry. You can get cracked lips. You can get a cracked tongue. Yeah, you ever seen, they always say the desert, like Arizona, is very parched land. When the soil is so dry, I mean, it's like you could crumble it. That's how you feel. It may last for several months, and sometimes it's permanent. And it makes eating and talking very uncomfortable. Mouth cancer treatment can also leave your throat and jaw feeling sore, and you will almost certainly have difficulty swallowing and chewing for a while. This can be very hard to cope with at times, but you cannot let it get you down. And of course, they can give you strong painkillers. They can also give you some protective gels to use to put on your mouth just to keep it moist in there to help you protect it. But like the last one says, even if you don't feel like eating, you're talking, bacteria is still growing. You got to keep your mouth and teeth clean. This will help stop the infection too from developing, and by God's grace, help you feel better. The surgery itself now. The surgery itself, when you're involving the jaw, the tongue, the mouth, the lips, and the throat, it's going to change the way you look. It's going to change the way you talk. But they have modern surgical technologies and reconstructive surgeries that are usually very good. And now they try to have minimum scarring. Okay? Even though they're major operations. But thank God for technology, equipment, that the outlook is much better than it was 10, 15, 20 years ago. But how you look at it is important as how you feel about yourself, your self-esteem. It can be very hard to accept sudden changes in your looks that you're not happy with. It is usual for people who have had surgery to their face to feel very angry, confused, upset for some time afterwards. You may feel worried about how your friends and your family see you. You may be worried about your physical attractive. Are you physically attracted to your partner now? Do they love you the same way now? And guess what? It's normal because we're human. You're going to worry about these things. Am I still going to be able to function sexually? It's important for you to remember that the people close to you will not think of you any differently as a person. But emotionally, you got to pull it together. Your family is there to support you as much as you will allow them to. So we gotta talk about our feelings. We gotta talk about our emotions. And some of us aren't used to doing that. But talking to them can help you feel more supported and less isolated. Because once you go into isolation, depression sets in and can take you down a path you have no idea how to get out of it. And that's why it says you must keep your mind stayed on who? The one above. Because there's only two ways to keep your mind. Keep your mind up or let your mind go down. If your mind goes down, you open up other avenues. And so you had no idea that the progression of dentistry could lead you down this path of depression. But those relationships are very key. Because being diagnosed with mouth cancer and having treatment will almost certainly affect how you feel about sex and intimacy. You may not feel like having sex or being intimate at times when you're dealing with mouth cancer. Remember, I told you about the dryness of your mouth, feeling cracked, the pain, the soreness, the mental fatigue. But they say you may find that sex helps you feel more normal during an uncertain time. Because how mouth cancer affects you sexually will be unique to you. That's not always unique to someone else. Because at that point in time, you feel normal again. The eye contact, the touching, the hormone stimulation, the caring of a loving partner can actually relax your mind. And that's how it helps you. But check yourself before you wreck yourself. According to the World Health Organization, as many as 80% of the world's people depend on traditional medicines for their primary healthcare needs. The development of the indigenous medicines and the use of medicinal plants carry considerable economic benefits in the treatment of various diseases. The use of herbal remedies have taken a global dimension, although today only a few million herbs have been approved for the commendable medicinal properties. A large majority of the natural occurring herbs are only considered as food supplements because of the lack of randomized controlled clinical trials. Currently, many studies are being conducted to know how these herbs work in depth. So I say that to say this. We can start using certain things nowadays to help us ease the burden of getting to the mouth cancer portion. So as we've dealt with the gingivitis, the dental tartar, the periodontitis, because all of these things were progressed into cancerous treatments because we didn't check ourselves, because there was so much plaque on around, because you're gonna see a picture where, how did you get those stones? I'm gonna show you. And you can say, how can a person let that grow that long? Depending on knowledge, depending on financials, depending on where they live in the world, all of these things play a role in there. But if you have access to dental care, utilize it. It's cheaper to pay now than to pay later. So what are some of those herbs that we're talking about? Myrrh. Take a screenshot. Myrrh. Myrrh helps to promote healing in cases of periodontitis. Gargle with the myrrh to help eliminate, what did she say? Bad breath. Somebody talked about it. It causes bad breath. Hey, if you can do some myrrh, and usually myrrh is in a lot of herbal rinses. Prickly ash is used to increase the flow of saliva and relieve pain in a toothache. So you can use it twice. Increase the flow of saliva. Remember, if we had a decrease in flow, or if we might have had a blocked duct, meaning we got two salivary ducts. If you lift up your tongue, if you look down, you have two salivary ducts there under the tongue, and you have two back here on the back of your cheeks, near your second and third molars, or between your first and second molar, depending on the person's anatomical makeup. But you got two salivary ducts on your cheeks area. Open up your cheek, look in the back, you see a little point hole there. That's your salivary duct. So prickly ash helps to increase the flow of saliva. Peppermint. Use peppermint oil for toothaches or to relieve gum inflammation. Red clover. Red clover is a mouthwash. Is used in healing for irritated and gum disease. All right. So I use a little red clover as well. So I have red clover, peppermint, and things. If you look up, I don't know how you guys can get it if you got Amazon or wherever you guys are in the world. Uncle Harry's is one of my pride examples of a whole ergonomic health and wellness essential oil line, toothpaste, mouth rinses, and things like that. They actually help to recalcification. So once you've decalcified your teeth, they have one actual paste that'll help you with recalcifying those areas as well. Rosemary. There's rosemary mouthwashes as well as used for treatment of gum disease and bad breath. Sanicle is an antioxidant, or use it as a salve to heal a wound. Sometimes, how many of you bit your tongue before? Yeah, we have. That works as well. Shepherd's purse. That's another one. It's used of fresh tops of the shepherd's purse to help stop bleeding or if there's tooth extraction. Tea tree oil is used in a mouth rinse. Soothe oral inflammation. Thyme is used as a salve. There's a salve that's made of thyme, myrrh, and golden seal. It treats oral herpes. Or if we got some strep, use that as well. Violets, it's a mouthwash. It's helped to relieve pain and tenderness as well from sores or from oral cancer. Violet is another one that you can use. Wintergreen. I use wintergreen as well. Very refreshing as a mouth rinse. So all of those are in the actual Uncle Harry's. And I can put that one in there if you guys can get it. It's great. And yarrow. Yarrow is the other one. It's used to treat hemorrhages, bleeding, ulcers, improve blood clotting. Use it to promote healings and cuts. And sometimes during the winter months, and sometimes when our lips aren't moist or we're not using our chapstick or something on our lip, we get those little side cuts. Yarrow is good for that as well. But we always want to make sure that we're using everything. To me, these are all after the fact. The first fact is you got to brush your teeth. You got to floss your teeth. You got to rinse your mouth out. And you got to see your dentist regularly to actually help to prevent most of these things from occurring. Okay. And so that's why I don't start with these first. I start with them, I bring them up later. But as we're winding down, then I want to make sure that everybody understands that what you're about to see, it might, upset you. Hopefully you're not eating lunch or anything like that. But we're going to see, what does mouth cancers look like? And because we have differential diagnosis, I'm just going to show you the pictures. And then you're going to see where they can form. See, we talked about taking your tongue, moving it to the left, and moving it to the right. That's why we want to make sure that things like this isn't happening. We said the vestibule. We want to pull the lip down. And so we can see all the tissue areas. Because nobody really looks at their lip. Especially when you're brushing your teeth, you don't look at your lip. But these can, because they usually are painless. So you don't even realize that they're even there or growing. So for the person who wasn't able to see the pictures, I'm sorry, but I don't know why. But I guess you'll be able to see the presentation afterwards. But these are very important to our health and healing. You're fearfully and wonderfully made. That's why we say, take your tongue and pull your tongue out, moving it to the left, moving it to the right, looking for abnormalities, because everything should be lined up and shouldn't be looking the same. In the picture on the right, looking at the overgrowth of tissue there, affected, loose tooth, that tumor now is pushing the teeth out of the way. So all of that is going to be removed. Check yourself before we wreck ourselves. Remember, we said to take your tongue and pull your tongue up. First picture is pulling that cheek, that lip down. Understanding, chewing tobacco, smoking products, things like that. It's not entering into our system and causing those stones to form and our saliva ducts to get backed up. And we end up with an overgrowth of calcium underneath the gums or underneath the palate or underneath the tongue area. See your dentist regularly. Do you think this person was seeing their dentist regularly? Not, probably not. And pulling up your tongue on the picture on the right, pulling that tongue up, looking at those vessels underneath there, making sure there's no blockage. Calcium buildup is in that area right there. You can see it forming right there in the center. Get your teeth cleaned regularly. Be treated. Go get it checked. See, pulling up that tongue again. See why I show you the tongue? Tongue is used for more than just talking. The reason why I'd say that, because your talking will get, what's the word I want to use here? Because if you get half of your tongue cut off, do you think you can talk properly now? No. You want to change the way you look, to change the way you eat? Small, simple things that we can do at home to make sure But nobody being able to see pictures?
We can
Okay.
see the pictures, Dr. Travis.
Okay, I was getting a message from a couple of people saying there's no pictures, the screen is just spinning. Okay. Now taking your tongue and rubbing it across the top of your palate. Do you feel any abnormalities? Or does it feel the same on the left side as it feels on the right side? No lumps, no bumps. Pulling your cheek out on the picture on the right. Pulling your cheek out, making sure everything looks the same. There's no white patches. There's no red patches. There is no white patch with a red center or white patch or red patch with a white center. Those are the things that we're concerned with, and making sure that you were wonderfully made and making sure everything is still working in order. And now we look at the surgeries. And see now, how do you feel? How would this make you feel emotionally, physically? And looking at the picture to the right, surgery, awesome job. My burden for you today is to make sure you check yourself before you wreck yourself, family. 660,000 cases, and half of them died because they didn't go get themselves checked. Because people don't realize your head and neck is all one mechanism. Because anything that happens to your mouth, guess what? You're only millimeters away from your brain. Bacteria here enters the brain and can also hit the heart. So now you got bacteria running rampant. Make sure you see your dental professional regularly. Surgeries are amazing. But as we wrap up here, I'm going to leave you with this message here.
Hi, I'm Dr. Joseph Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk about something today that's very serious, maybe even deadly. And a number of years ago, we had a very sweet woman who came to our office, and she had a large white patch on her gum. Now, she had seen her dentist several times, and the patch was growing larger and larger and larger. Our dentist dismissed it, didn't think anything of it. I think she actually saw an oral surgeon somewhere during that time also. But when I saw this large white patch, and you'll see what I'm talking about, I became really very, very alarmed and immediately sent her to the oral surgeon that I'm acquainted with, and it turned out that it was cancer, and it was significant cancer. In fact, cancer was so significant, she had to have virtually almost her entire upper jaw removed, which she did. And fortunately, they were able to excise the entire lesion. They had to take some skin from her arm in order to cover the wound that was created in her mouth by the surgical removal of the large cancerous tumor in a large part of the jaw. But quite frankly, and you'll probably hear this from her, it probably did save her life.
At first it was just a little white line on my gum. And it wasn't hurting. It was just a really tiny, it wasn't even half an inch long. But the line started getting longer. Still wasn't hurting me, but then it started hurting, and it more than a line, it got looked like it was an abscess or something on my tooth, and that's when I knew something was wrong. Not only that, but it was painful, and I don't like pain. I had been going to a dentist for years, and he didn't address it. He just said it was nothing. But so then I found Dr. Nemeth on the internet, and he came in, and he steered me in the right direction, and from there I found out that I had cancer. Basically, it saved my life because nobody else had, led me in that direction, and this had been going on for years. This was back in 2015, and this is 2018, and I'm still coming to Dr. Nemeth, and I'll keep on coming to Dr. Nemeth because he really helped me.
She's now pretty much completed with healing and ready to get some teeth in her upper arch, which up until now she hasn't had since the surgery. Mouth cancer can be very serious, and even in obvious cases like this, sometimes it's neglected. And I unfortunately know of a number of patients whose mouth cancer wasn't detected until it was well advanced, and unfortunately they did not survive. If you smoke, particularly alcohol, all of these things predispose one to mouth cancer. So any lesions, anything unusual in your mouth, get it checked out. Make sure your dentist takes a look at your mouth and checks it for any lesions or anything unusual. Most of the time it may not be anything, but once in a while it is, and it can be serious. So take care of yourself, take care of your mouth, get checked up regularly. If you have a healthy mouth, you're going to have a healthier body.
Absolutely. So you can see.
Hi.
Now, you saw what happened there. She went to her dentist and he sent her home. But it's your body. You have to understand when something doesn't look correct, when it looks abnormal. And sometimes you have to take your health in your own hands. Because I know that this doesn't look right, and I will push the issue. Of course, that was done some time ago, but now more dentists, they're taking more continuing education classes and things like that, talking about oral cancer, because it's becoming too normal now. And it's happening all over the place. And so now, like he talked about, keep pressing the issue until you get the answers, because if you don't get the test and they don't give you your negative results, then keep moving. This doesn't look right. It's not healing. Something is wrong. My body is feeling differently. But you can see as she was pressing it, it took some time. And she didn't think anything of it. But I'm giving you the time factor. They say 3 weeks. I say 2 weeks. If it doesn't look like it's getting better and nothing is happening, push the envelope. Go get yourself treated. Go to an oncologist, go somewhere. Go to your dentist, follow the protocols. Go to oral surgeon, from the oral surgeon. Then I'm going to go see my oncologist from the physician side. Because they're all going to end up working hand in hand together. So how are you going to make sure that you stay healthy? Number one, stop smoking, stop your drinking, eat balanced diets, get your walk on, drink your water, proper rest, proper ventilation, self-care, trust, relax, visit your digital team regularly, as often as you can, floss, brush, then rinse. Take care of your body just as your soul prospers. And I tell you, leave you with this. God bless you and keep you as you take care of your temple, as he's blessed you with. And always remember to spread love, not disease. Thank you so much, guys, for allowing me to share this platform with you today. Sorry for my scratchy throat, but God is still blessing. And I pray that you will learn something from this and that we will help those that are around us that can actually take care of their bodies. So much is given, much is required.
Thank you so much, Dr. Travis. Thank you. That's all I can say is thank you. It's what's the word? Eye-opening when it comes to oral health. So thank you. Thank you so much. I'm not sure if you have time to just answer a few questions.
Absolutely.
Yeah? Okay,
Yeah.
thank you. Thank you. So I'm not sure if anyone would like to ask any questions. I'm just going to have a look in the chat. I'm sorry, I can't put my camera on as yet. But I know someone did mention that she said, people please listen and take note to see your dentist regular because of her fear of the dentist due to a few bad experiences. She never went to see the dentist for over 6 years and she paid the price in a massive way. So she's saying in capital letters, see your dentist on a regular basis. So yes, see your dentist. Let me see if there's any more. Should children be using mouthwash? Can children use mouthwash?
But kids depend on the age group.
Okay.
And what I always say is give them water first and tell them to swish it. If they can swish it and then spit it back out in the sink, then they understand the mechanisms of being able to close up their throat while they swish versus, swishing and drinking it. Because that's not the first thing you want them to do is try mouthwash for the first time and then they swallow the whole thing. So I would say try them out, depending on their age group. Yes, they can, but if they can't understand how to swish water first and then, hey, can you swish? And then spit back into the sink, show me you can do it. And try with something easy, water. And if they can do it with water, then they will be able to do it with mouth rinse.
Okay, thank you. Thank you for that. There's a lot of thank yous. Great presentation, Dr. Travis. Once again, you've shared very timely information. Oh, receding gums. I'm not sure this is a direct message, but it's to ask regarding receding. Please ask about receding gums, but I'm not sure in what sense. But it says please ask about receding gums.
Okay, receding gums. What we're looking at is now, if you remember the video, and I always say we have biceps muscles, but we don't always have to use them. And usually what we're doing is mentally, we think a soft toothbrush is too soft. So we add the bicep into brushing and we're going this way versus, rinse with you see my wrist? My wrist is doing the motion as we're moving across the mouth. If we're going this way, back and forth, they say small circular strokes. Small circular strokes mean you have to really contour that brush. So when we end up getting, brushing laterally or back and forth. Now, if you look at your teeth, when you lift up, when you're doing your exam, look at your teeth and your gums. Your gums are oval shaped and your teeth are in an oval shape as well. So therefore, if you're going back and forth, you're going to be touching the top of that gum going back and forth. So what happens is you start wearing those gums away. That's why we say no medium and no hard toothbrush, because that means you're going to wear them away even faster. So if you're doing slow, small, circular strokes, then you're less apt to recede your gums or cause deterioration of your gum tissue during that time. And so by God's grace, we're always in a rush. Brushing is the last thing we want to do before we're running out the door, right? So take your time for at least 2 minutes a day or 2 minutes at a time. Small circular strokes, making sure we get in between those teeth and gums, and then moving forward from there. So that's how we help with receding gums. Once you got receding gums, now we got to deal with that issue because, like I said, your roots are now exposed and your nerves are exposed. So therefore, sensitivity. But if you look at Uncle Harry's, they got what is called remineralization. That's what it's called, the remineralization gel, and they have a powder that you can use as well. And that can help to actually restore that area and try to desensitize those areas. Because, like you said, drinking cold, drinking hot, you're going to feel it. Sucking air between your teeth and you get that sensitivity that, it hurts. Yeah, it doesn't feel good. It doesn't feel good.
Thank you. Thank you, Dr. Travis. Linda, can you see anything that I've missed?
There was a question that was sent through to me about asking if the doctor could explain about the gums receding and the space between the gums and the teeth as people tend to get older. What causes that, and how can someone actually continue to take care of their mouth, their teeth, and their gums as they actually grow older? Is there anything that they can do to try and also remediate that?
Ooh, that's a loaded question.
Oh, sorry.
Spacing between the teeth, we can call it one or two things. We all should have 32 teeth, 16 on the top, 16 on the bottom. Life happens, wisdom teeth are removed. That's the wisdom teeth gone. So now you subtract it. That's -4. So now we're down to 28 teeth. Then all of a sudden we begin to start eating, not brushing, vice versa. We get a periodontal infection and we lose another tooth. Or we get a cavity in a tooth. There's another extraction. So now we're dwindling down. Anything between two teeth that removes, you have what we call as a normal mesial drift. This is the midline, right? We always say the midline, just like in your body, you have a midline in the body. Your teeth have a midline. Anything that's closest to this line, we call it the mesial. Anything away from this line, we call it the distal, distance, away. And so if you take anything out in the middle, the tooth behind it, guess what it does? Everything flows mesially. That's why your mouth is in a downward area. Your mouth is not straight up, it's not in a level plane. It's a downward action. Even if you take a mold of your mouth and you see your teeth, you'll see they're in a downward shift. So therefore, if you take anything out in the middle, then the teeth in the back are going to go mesially drifted toward the midline. And so when we start getting spaces, now we got to look at, okay, are we tongue thrusting? We tongue thrust, depending on if we're sleeping, if we ever sucked our thumb, different habits, because you can change your palate, upper palate, by your actions. So basically, you take your thumb, here's the action. See my thumb there? You see it has a hook on it. And you take that same hook, you put it in your mouth. That's why we try to keep the kids from sucking their thumb. Because if those who suck their thumb, guess what ends up happening? They take their palate and they pull it forward. So then, and then we got what we call is either buck teeth, you want to call it, vice versa, but they're over bite, because now they've taken the normal arch of the teeth, which should be fitting, similar to that, like this, closed up. Now the top teeth will go this way, which is a forward look, because you've actually thrusted them forward. So all those mechanisms help to actually either, number one, create a spacing with our teeth, with our sucking our thumbs and everything like that. So we change our normal body anatomical look. So we want to make sure that everything stays together. So how do we put it back? If we stop tongue thrusting, there's like little guards they can put in your mouth to keep you from doing that, little appliances they can use. But as you get older, you start losing more teeth. You started getting crowns, and a crown is a fake tooth, even though you got a real root underneath. So that fake tooth on the top, and you got a normal tooth on the bottom, guess what? You're hitting against something that is flattened and is hard. So your bottom tooth knows it's not normal. So it starts to wear down that bottom tooth. So now my teeth are now flattened. It used to be sharper, That's because what are they occluding against? They're occluding against a piece of metal. So you keep hitting some metal, and guess what happens? Your arm is going to get sore. You're going to bruise your hand. Your teeth are nothing different. Even though your teeth are hard, calcium built up, if it hits against a steel crown, it's going to do the same thing. You're going to flatten it out. And now all of my teeth on the top are crowns. So guess what's going to happen to all your bottom teeth? They're going to all become flattened.
Wow. It's quite an interesting process there.
Yeah.
Thank you so much, Doctor, for that. That was actually quite insightful.
Mhm.
There was also a question with regards to what can one do, or how can one remediate a situation where one finds that there's the grinding of the teeth when you're sleeping?
Mhm. Oh, yeah. You stressed out. You're stressed out. What does your body do? When it gets into this when you get down to your sleep modes, right? That's why you have dreams and different things like that. And so when you get into that subconscious stage and you're in that mode, basically your body replays what happened that day. And that's why they always say, stay off of your mobile devices at least 1 hour, no television, anything like that. Play something calm, never get in an argument before going to sleep, because that hypes up the body and you don't get proper sleep. So when you're sleeping at night, your body replays. And if you're a person who don't like conflict, and you are a person who harbor everything, then you aren't adequately sleeping at all. And so eventually it's going to catch up with you. And when your body bursts, it bursts through your mouth, bursts through your teeth. Your teeth are grinding, clenching. Oh, I wish I had said such to homegirl or whoever it was. I should have told them off. But because of you harboring everything, now your teeth are grinding. And so now you need what we call a night guard, because you put all that pressure into a guard versus toe to toe, teeth to teeth. You go teeth to teeth. Guess what? That's just like metal to teeth. You're going to start grinding because you're going, oh. And sometimes you can hear people who are grinding. Remember your kids? You can hear that some people say, would you quit doing that with your teeth? And they don't know they're doing it, but they're literally grinding their teeth, and it's a loud noise. And sometimes as an adult, you don't even hear it, but yet you'll wake up in the morning and your bottom jaw or in your TMJ or your side panel here is sore. And it's like, why is this sore? My mouth. Or you get what we call locked jaw. And locked jaw, basically, because the temporomandibular joint, the nerve, the bustinator nerves here or muscles, basically tighten up because you're clenching. You can see mine push out because when you're grinding, you're clenching, and that muscle is stressed. You've stressed it all night long. And sometimes when you get in the morning, it's locked and you can't open. And so basically we say you get a night guard to actually help you, but that 1 to 2 hours before going to sleep, take a breather, break it down, relax your body before you go into the actual mode of sleep. Because sometimes we'll work, and then we think we're just going to take a shower and go to sleep. Your body doesn't work that way. You need to take your body down slowly, boom, 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 to be able to receive sleep. Just like you guys were ready for the Sabbath, basically, or now you work, oops, that's it, boom, shut it all down. No, we try to just like relax, get ourselves into the mood, get our minds ready, and just relax at that point. You don't run to the brick wall and say, whoa, boom, and just stop, because your body was still hyped up. So it's hard for it to take that transitional phase. And just like when you're sleeping, just check yourself before you wreck yourself. Relax before you go into sleep. Self-care, woosah, play some soothing music or something before going to sleep, so your body knows it's about to take a rest. And then get yourself into a routine.
Sure. Mm-hmm. Thank you. Now I realize why throughout the presentation you kept on talking about the importance of relaxing and not stressing out. And I think also just ensuring that your mind is in a good space at all times. And I think that's, as you were speaking, I was thinking the importance then also of just, praying and taking that time to ensure that you are actually calm before you go to sleep. We had 2 questions on our YouTube. I'm just going to break from the questions on Zoom. We're going to come back to them. But we had 2 questions on our YouTube platform. The first, Doctor, the person is asking, do you have any advice on root canals? I know it sounds quite broad, but any advice on root canals?
Advice, and that's a hard question because you have advice which way? Which way? To get it, you got 2 sides. Get a root canal or get it extracted. Mm-hmm. All right. What is a root canal? Root canal is basically there's an infection in the bone area. Okay, so you got your tooth. It looks good to me out here. Not until you get the x-ray and you see there's a dark lesion across the top or sides of that root, which means there's an infection there, which also means bloodstream, rest of the teeth. So I always say, which ones you want to do? Root canal, remember, it's a math problem. Math problem means we get the root canal done, we solve the equation, or we extract it, meaning we're going to subtract from our total amount of teeth. And if you subtract it, you better put it back. Something else has to go back there. And I always say, if we need to extract it, number 1, we can do a bridge, which means they're going to now affect the 2 teeth in front of it, or 1 in the front and 1 in the back. And you're going to put a bridge to close that gap up. Or within 6 months, you get an implant done. So with the root canal, I say, to me, it's better to save the tooth than to extract the tooth.
Okay.
Okay. But
thank you.
get the root canal done because the infection is there. The infection it's got to go. That's just like walking around with a stomach infection. You know, you don't want a stomach infection because that's going to hurt my food and I got to eat in order to grow to get my nutrition. So just like your same food that goes in your mouth is the same food that's going to the rest of the body. So your teeth are going to get the same amount of nutrition. If you're feeding it high in sugar, high in whatever, wheat, yeast, vice versa, all of that is going to play itself back out into his body. That's why I said a person who has too much wheat, too much breads, too much sugar, that's a candida patient. Yeast infection. Yeast infection comes in your hormone hormone areas, or it's going to come out of your mouth, and you can see white patches there as well. And someone is talking about the tonsil stones, and usually that's bacteria backed up. That's calcium. Too much calcium production can cause that. Food can get trapped in those areas when you're swallowing, or a piece of rice, a grain, millet, quinoa. Those can get trapped into those areas, into those duct areas when you're chewing, and all of a sudden can block it. That's why we say brushing your cheeks, brushing your tongue, and cleaning the floor of your mouth, because when that bacteria builds up, it can actually sustain something else from flowing properly. And those salivary ducts, when you get a chance, go look in your bathroom mirror, take your cheek, open it up, look at that salivary duct back there. You can push it, press it, and sometimes it will get inflamed as well. And when it gets inflamed, that's when you need to go see, hey, try to massage that thing, because something's in there. Could be a piece of calcium, or it could be anything, food, whatever, bacteria, debris that's in that area that is causing it to be blocked. And so that's why we always say, check yourself, check yourself. We don't want to wreck ourselves.
Thank you so much. Thank you so much. And I hope that answers the question that was asked. Thank you so much for that. The second question that we had on the YouTube platform was, what are the best ingredients for making homemade toothpaste? I'm also curious about this one.
Yeah. I don't know. A lot of them use bentonite clay. Some of them use charcoal. I'm a purchaser, you know. I'm gonna be blunt. I purchased it, but bentonite clay. You saw some of the herbs that were there, but bentonite clay is a good one. Charcoal is a good one. They have some essential oils that you're gonna mix with them as well. But I'm just a purchaser. I can't even. I won't even know. That's a good question, though. That's a good question, though. Matter of fact, you can go find out, go buy one, and then utilize what they have in there, and then you can make your own.
Yeah, thank you so much. The other question then that we had, and I suppose I'm going probably to the health stores and just trying to find out, could actually help as well to try and get more information on that. Exactly. If we could also just go back to the Zoom platform, there were two other questions. Somebody asked a question, I'm just going to read it. Is there concern for teeth marks on the lateral border of the tongue? Is there a concern about teeth marks on the lateral border of the tongue?
That's a loaded question as well, because we got to understand, what are those teeth marks? Are they chipped teeth? Or are they normal teeth wearing on the, I knew that question was going to come up too. This is another one I just saw. I have to see a picture because that's a broad, normal teeth marks. So I don't think, if there's no cut and there's no signs like we talked about, the white, teeth marks are one. That means teeth, are you talking about teeth indentions? So that's one. If it's a teeth, normal mouth, and there's just indentions, that means we got what we call macroglossal tongue. That means that tongue is large than the mouth is. Okay, that's one way to look at it. Usually when you got something large in a smaller space, then it's because most time if you use your tongue isn't pressed against your tongue. I mean, your tongue is not pressed against your teeth. Okay, so normally the tongue is larger than the actual mouth is, you may have those, what we call those ridges of the tongue or teeth marks on the tongue. Not a problem. That's normal. Only marks we're worried about now if you got a broken off tooth that has not been taken care of, and it's a sharp edge, and your tongue keeps hitting that edge, then yes, I would worry about that, because you're opening up a wound. It's just like me going outside and, you know, I'm skateboarding and I skin myself and something gets trapped in my leg, and oh, I just brushed it off, or I just got some hydrogen peroxide and cleaned it off. Okay, but that's whatever that something was, could have been bacteria that was on that ground, or somebody else's blood that dried on the ground, or vice versa. Now you've actually mixed that bacteria into your area. Same thing with your mouth. We want to make sure that foods that you're eating, spices and everything like that, your tongue is not lacerated or cut. And now you're entering into your tongue bacteria growth. So long as that's not happening, you should be fine. But once that skin gets broken, then we need to make sure we got a rinse or something that can try to, a salve or something we can put on our tongue just to heal that area, or go get that tooth fixed to make sure now that if a crowning needs to be placed, that tongue will heal once that problem has been taken care of. Because as long as you're talking and eating, it's going to keep hindering that tongue from healing.
Okay. All right. Thank you so much for that answer, Doctor. I do notice that we have 2 more questions on YouTube, but before I go to the YouTube, there was still one more here on this Zoom platform that I just want to raise. There's a question here that says, when it happens with, okay, I'm not sure what was being referred to here, but the question is, when it happens with children, does it mean the same with them? I don't know, Valerie, if you'd like to voice over the question that you had in the chat. I can't recall at which points we were in the conversation that maybe you had raised this question. I don't know if
Yes,
you'd like to unmute and just voice over it, please. Thank you.
So sorry about that. It was with the grinding of the teeth, because children does it sometimes. So I'm just asking, does it mean that they're stressed when they're doing it?
Just remember, I always say epigenetics, and I always say, when you had the kid, were mom or dad under stress, under pressure, under constraints? Because whatever you have prior to, it also trans through the placenta. And so it does not mean for the kids that they're stressed, but nowadays it could be, because kids are under a lot of pressure these days to perform in school because of their siblings. What do we say? What do we say a lot? How come you don't behave like your other sibling, your sister, your brother, or you always doing this, or you always doing this? So they're having expectations upon their heads. And with school, and you got to look at pandemic. So you got a lot dealing with a kid now, because kids are emotional, social human beings, and they are friendly, or most of them are friendly, right? During the pandemic, you took a lot of that away from them. Stay at home, you're on the Zoom platform, you have virtual friends, and depending on their age group, to them, this doesn't seem right. We don't get out to our family, our friends and our family. Or if I used to see you and I used to hug you, or I used to dap you, or we used to have some type of a call and response when we see each other. But now I only know you by virtual. I only know you by the picture you put up. I really don't know who you are. So I'm talking to people all over the world. I have no idea. I have no physical connection to. So now you have kids who, number one, because they're online or wherever their schools are, some of them are back in school. Our places are back in school, but some of them are still online. And yet all the teachers feel that, oh, you're at home, you could do all this schoolwork. And so now they got a lot of work upon them, but there's no physical touch or talking. When we used to be, I used to stay after school and get help. So now parents are having to help the kids with their schoolwork because my teacher is on the line and then she's gone. So now I'm left to do all this work, and I don't have that after school time or that one-on-one that I really do need. And I don't know how to go because my parents can't help me because depending on where they finished in school and what they are dealing with. Can they help me with this math problem? Can they help me with this chemistry problem? And they're at their wits' ends. So what is left for them to do? And so they are under a lot of stress as well. Now, do I say go get a mouth guard for kids, depending on their age group? Are they above the age of 6, 7, 8, where they got their permanent teeth down? Because we need to start saving those, because they won't get another set of teeth after 12 years old and their second molars have come in. That's it. That's their complete set. So now everything that they break or they grind now is going to affect the rest of their lives. So after the age of 12, 13, yeah, they can get, but remember, they don't hit puberty until, well, now they're saying puberty happened early on in life. Now, what they're telling me, age of 9 for girls now. You know, when we used to hit, you know, my age group, we was at 15, 16, you know, where you hitting that age group, understanding yourself, but yet now it's happening at an earlier age, and your mouth doesn't stop changing because you're still growing. And like you said, you have to grow into your mouth. So if you get a mouth guard for a kid, you're going to end up getting another one within 6 months to a year, because their mouth is growing and is moving and is shifting. And so for kids, it's hard. It's a hard thing for kids nowadays because they're dealing with stuff that we didn't have to deal with. And so that's why we say exercise, drink water, give them proper rest, but yet talk to your kids, understand your kids, understand what they're going through and how they're feeling. And that's something that we don't do. And that's something we don't do.
Thank you so much. It's actually, as you're answering, one of the things that I'm thinking about is just how important holistic health really is. And also good relationships just across and how we deal with one another, in the raising of children, in being circumspect about how our things affect us as adults and how those translate in the home. All of it just joins together, and we really need to be conscious and mindful of that at all times. Doctor, I'm going to do the last 2 questions on YouTube, the last 2 questions on Zoom. And after that, we're not going to be taking any more questions from anyone. But remember, we do have the TTI Telegram platforms. If you do have additional questions, etc., you can raise them, and we will ensure that we find a way to ensure that you get the answers that you seek. So I'm just going to do the last 2 on YouTube, and the last 2 on this Zoom platform, Doc. The first one is, what can be done if you have your back wisdom tooth removed and the next one starts protruding up past the gum line?
Okay, let me make sure I got that correct. You said after you've had your one removed or all the wisdom teeth removed?
It doesn't really say how many. It just says after you have your back wisdom tooth, so it's one removed, and the next one and the one next to it starts protruding up past the gum line.
All right. So remember, everything is fearfully and wonderfully made. He gave you 16 on the top and 16 on the bottom. You just remove one. That's a subtraction. So guess what's going to happen now with the other tooth that's under the bottom? You take this one away, he got nothing to occlude against. You see what happening?
Yeah.
Automatically starts protruding up, because that's why everything is connected. That's why there's grooves in the teeth, and your bottom grooves are put where they are. That's why the grooves are there. They're there to actually give you a true connection. It's just like having what do you call it? A pulley. What's the little thing called? Okay, train tracks, right? The train, the wheels, everything has to move together. If one thing is out of sync, guess what? It throws everything off. You extract one tooth, you just threw off your bite. Even though it's a wisdom tooth, you had a wisdom at the bottom. It will start protruding up past the gum line only because there's nothing on the top line anymore. So usually when we always say, even though there may not be anything wrong with the wisdom teeth, we're going to take all 4 of them out at the same time. Well, they say, well, only one is bothering me. Yes, but if you take that one out, Now you're going to cause issues on the bottom because the bottom needs something to occlude against. And if there's nothing in its way to keep it down, see the bottom, the top keeps it down. The top, the bottom one keeps it up. Once you move them, because your body is always moving and drifting. And if you're clenching on top of that, it's even shifting, getting even more. So we want to make sure if you subtract one, you might end up subtracting two. Because once one is gone, it's an addition subtraction problem going on the rest of your life.
Okay. Thank you so much. Thank you so much for that. The second question on YouTube is, what causes a dry mouth in your older years?
Linda, we struggle to hear you. You seem very far.
Yeah, your volume went down.
Can you hear me now?
Very low.
1 second.
Do you want me to ask the question for you?
Is it better?
It's still low. Yeah, it went low for all of a sudden.
I don't know if you
That's
can hear me
better.
now. Is that better? Okay. The question is, what causes dry mouth in your
No, it went again, Linda.
The question is, what causes dry mouth in older years, please?
What causes dry mouth in older years? Medications. Saliva, you're not as active. The older we get, the more sedentary we become, right? Or if we're utilizing any medications, that's also another issue. Like we talked about, any diabetic medications, blood pressure medications, a lot of them, if you read the side effects, they say may cause dry mouth. Well, nobody's exempt. So if you're using a medication, dry mouth may become a part of it. Or if we're becoming sedentary and we're not moving a lot, just like when we get anxious or we get nervous, what ends up happening is you produce a lot of saliva, right? But if you're just living a sedentary life and you're getting older and we're not moving as much as we used to, then your body begins to start slowing down. And that's also with the saliva production as well. But if you're adding medications on top, then that would be another reason why the side effects, you'll be reduced in saliva flow too. So those are some of the things that can cause dry mouth, or you may have a disease that will also cause it as well. And just make sure that you're not, excuse me, doing any mouth rinses or things like that, or drinking alcohol, because drinking alcohol would also basically dry your mouth out too. Because that's usually when you'll see somebody who has an alcohol, they got water next to them because they feel so dry and thirsty. And if you're out in the sun, another good thing, it will also cause dehydration as well.
Thank you, Dr. Travis. Linda did mention about 2 on Zoom. I only could see 1, so I'll ask that one, and then I'm not sure of the other one, unless it was private. But you did mention it and say I knew it was going to come up regarding fluoride. So, I'll ask the question: is fluoride a good thing or a bad thing?
Like this, I mean, I don't use it, but I'm in public health. So public health means you need to protect your teeth at all costs. And what do I say about that? And people say, but it's toxic. Okay. You got water that's toxic. You know, if you're not drinking bottled water, you got frying of foods, because oil is also toxic once it becomes heated at 400 degrees. Am I right or wrong? But we look at fluoride as being one of those which we don't ingest, and you're only talking about brushing your teeth for like a minute, and then you're gone. 1 minute to 2 minutes, and you're gone. And so usually when I'm on the inner city portions and I'm helping them out, do I fluoridate their teeth? I sure do. Why? Because it puts a protective barrier along their gums and their teeth, and it helps them to actually protect those areas. Because on here, a holistic, yes, holistically wise, you want to keep away all the toxin. Absolutely. But it also has a protective barrier, which also helps your teeth to actually remineralize themselves. And you're only talking about 1 part per million that you're actually seeing. And do I need it? No. Do I eat green vegetables? Yes. Do I have kale and spinach and things that are high in calcium? Absolutely. So there's always alternatives to everything. And that's what I would put, But do I have somebody in the inner city saying, hey, here's a $7 bottle of mouth rinse, and I need you to replenish it every week that you need mouth rinse, right? 9 times out of 10, they're not going to do it. Why? That's $7 to $8 a week that they don't have. And so something simple as fluoride, easy, you know. So I'm on both sides of that coin. And but if you're trying to live a holistic life and you want everything all natural, then, you know, split case.
Thank you, Dr. Travis. Thank you for that explanation regarding fluoride. Linda, you mentioned there was 2 questions on Zoom. We talked about the fluoride. Is the other one about sunken jaws?
No. There had actually been another one that was sent to me personally, but because my network went wonky and I had to dial out and dial back in, I've actually lost that question. But I did ask the person who had sent it, because they didn't want to voice over it, if they could please just send it to me again. But if they're unable to do so in the next couple of seconds, I do apologize. I can't recall exactly what it was. Maybe the doctor can just answer the one that Valerie has asked about whether the removal of teeth can cause sunken jaws. If the lady that sent me the question earlier does send it through before we close, then I will pass it on. Apologies for that.
Yes, absolutely. Now, did you see the cancer video of the lady there and what happened when they removed all of her upper teeth, right? And then they had to take her maxillary. So remember, this is the example here. I'll get close. You only have lips because you have teeth. You only have teeth because you have bone, right? So this is all a part of my chin, mandible, teeth are in the mandible, and I got, you see these cheeks here? Cheeks are here only because I got a maxillary arch. I have teeth. If I lose the teeth, guess what happens to the bone? You see that? It goes away. And if my teeth are gone, guess what happens to my lip? Okay, prime example. There may be some older individuals on here. And I always say when we go to the care facilities, right? The elderly care facilities. And grandma is so happy to see you. But guess what? When she sees you, why does she look like she's frowning? Right? Looks like this. You get uncontrollable jaw movement because you've lost the teeth, you lost the bone, and now the cheeks are no longer there. You're fearfully and wonderfully made. Everything connects together. So if I got a bad tooth, that's why the dentists always say, hey, we extract that tooth, guess what we're gonna do? We're gonna do a bone graft. Why? Because we don't want this sunken jawline. Because if you ever later, you come back and say, hey, I got some money, I want an implant, but guess what? You didn't put the bone in there. It's going to be hard to put an implant where there's no bone. So yes, once you lose a tooth, it creates a crater because bone does come with that tooth. It'll create a crater in that area. And if you lose another one, that's even a bigger crater in that area. If you lose another, there's a bigger crater in that area. And all of a sudden now everything gets to sink in. And if you lose all your bottom teeth, that's why the whole lip folds in. Because there's no bone there to hold it up. Just like your cheeks will leave as well. You lose your whole upper. Like if I go back to that video and you look at her, that even if she wanted to smile, she can't smile.
Mm.
Because the top jaw the top teeth are gone. So you got nothing to raise up. All of that, your teeth are here to help raise this up, to create a smile line. And if there's no teeth there, everything goes like this. Yeah, she was talking and you heard her talking, the speech changes because there's no teeth there. And she got good. So try to smile and your mouth look like this. You can't smile. You've lost the smile muscles. So I hope that answers your question with the once you lose a tooth, does a jawline, it doesn't happen immediately. It's over a period of time. But once you lose a tooth, you need to replace that bone, put it back. Just so if something happens later, you have all of your bone structure there.
Thank you so much, Doctor. Thank you so much for such an informative talk. Indeed, the title of this talk was well suited for it, oral health and beyond. And we really, really went into the beyond. It was very, very informative, and really enlightening as well. Like you said, for some of the stuff you might have heard it before, but for other things it might be new. Just how serious it is to really take care of your mouth, and yeah, really take care of your body. Like everything, like I said earlier, was interconnected, from mental health being in check, your health of taking care of your body and exercising, etc., being in check, down to, or rather including your oral health as well. And I love it because you kept repeating the fact that we are fearfully and wonderfully made, and that is the theme of this season of TTI, is that we are fearfully and wonderfully made. And you see that indeed there was a designer behind the human body, because it is absolutely amazing how interconnected things are and how they are dependent on one another to be able to give a good function for the entire human being. And indeed, there is a God who designed that, in my opinion.
The great architecture.
Definitely.
Architect, yes.
Great architects, definitely. So I didn't get that question coming back again, and I do want to apologize to the person who had asked it. If they can get in touch with us on the TTI Telegram platforms, we would really appreciate it, and then we'll be able to try and navigate how to get a response to that question. But I also want to just thank you, Dr. Tramel, for your time. I know it was early morning on your side.
I'm awake now. I'm awake.
You're awake now. When you got online. But thank you so much for the time, for the sacrifice, for the preparation, for sharing the knowledge as well. We are really, really grateful. And the viewers on YouTube as well send their thanks for a very informative talk. And really, indeed, there's something you said earlier that I just want to repeat, and that is the fact that where we have more knowledge about what has happened, we have a greater responsibility for how we take care of ourselves. God will hold us accountable for what we knew and didn't do. Therefore, now that we know better, may God help us to do better as well. And if somewhere along the lines we fell off the wagon of doing better, let's get back on and continue. So thank you so much. And I'd like to thank everybody again for dialing in, for participating, for all of your questions. It really makes the session really, really fruitful for everyone that actually joined. And we really thank you for all your questions and for helping us think about many things that we might not have thought of had you not asked that question. So thank you so much for taking the time to come on this platform and for engaging with us. And I also want to thank our viewers on YouTube. Thank you also for engaging and interacting on that platform. May God really bless each and every one of you that has dialed in today. You're reminded that next week we're going to be having the talk with Louise Reed about vitamin K. Please do dial in again. And until then, stay blessed. Take care of your mouth. Do those checks and be good to your mouth, people. Be good to your mouth, and it'll be good to you. So thank you so much. Thank you so much. I don't know if, Charlene, there's anything else extra or that I may have forgotten that we might just need to go over.
No, you said it absolutely beautiful. So nothing from me. Just thank you, everyone, for joining us.
Okay, thank you, everyone. We're going to be switching off the live stream on YouTube now. So thank you again to the YouTube family, and please do share this information with others. And thank you for joining us. We'll then be dialing off as well. Thank you so much, everyone.
Do we have a final word from Travis? I thought he was trying to say something.
I beg your pardon, I can't hear you.
Do we have a final word from Dr. Tramel? I think he was trying to say something.
Oh, no, no,
Oh,
no.
I apologize.
I was reading the chat there. No, I was reading the chat.
Oh, okay.
But yeah, no. The final thing was somebody was saying, well, how come the dentists don't discuss all of this information? Because you're only there for one reason usually, and it's usually get me in, get me out. Now, we just took about 2.5 hours. Wow, I didn't even realize that. That how much time it takes to understand yourself. And that's why I always say, check yourself before you wreck yourself. You can wreck yourself going to the dentist because you could do yourself a disservice by saying, hey, I only came in for this one thing right here. Fix this. Mm-hmm. But then there's other issues that's going on in the body that you're not mentally concerned about. But based on the information I gave you today, that now you can go back, now you're knowledgeable, and I guarantee you the attitude of the dentist will change. Because you care about your body. You're not here, because that's what we call it, family dentistry. Because we want to be your family. You wouldn't go to somebody and say, hey, I don't like you. But yet you're gonna pay them, right? So we're there to be your other family member, your brother, your cousin, your whatever. Family members treat family members a certain way. Sometimes they say blood is thicker than water. That's your friend, but I hold my family closer to me. Just like in a dental office, I want to take care of your whole body care, even though we're just here, but I want to talk about this. Well, I'm busy. I don't have time. I gotta go, right? And so that's what people have to change their mindset is it takes time to heal. And if you're always wanting a quick fix, and that's why, like I said, I don't talk about herbs. I don't talk about vitamins. I don't talk about any of that stuff first, because to me, that's secondary. That's a bonus. But there's certain things that you got to do daily. If you're not eating healthy, guess what? You're going to get problems. If you're eating a high sugar diet, you're going to get the cavities. And that's the same thing I tell the kids. How many of you like getting shots? Oh, no, I don't like getting shots. How many of you like eating candy? You know, too much candy, too much sugar, if you're not brushing your teeth properly, then it's going to cause the cavities, which is going to end up getting a shot. And so if we don't want the response of oral cancers, then we got to make sure that the stuff that we're putting in our bodies is actually helpful. And that we don't have a cheat day or a cheat week, what we call them. Oh, this is my cheat day. Oh, my cheat day. Yeah, that day ends up being 1 day, 2 day, 3 day. And the next thing, oh, I got pounds on me now. And now that pound's going to take me a year to get off me. But just understanding that those things that we have, yes, indeed, knowledge is powerful. But knowledge can also hurt you too, because once you know it, you can't go backwards. To much is given, much is required.
More is required. Thank you so much, Dr. Tramel. Thank you for those words. Definitely will remember them, and I really think no, definitely. Well, I will. I don't know about everybody else, but I definitely will. But it really becomes important, I think, again, taking care of ourselves and being responsible for the bodies that God has given us, for the minds that God has given us, doing that research to understand how our bodies work. And knowing how to pick up issues with our own bodies as well. That becomes very important. Thank you once again for your time. Louise just put up a comment. Louise, you know, this is probably going to sound bad. I don't mean it to sound bad, but I think the older generation sometimes of doctors and dentists really had that thing of, you need to understand what's going on with you. Let me tell you, because you don't have to keep coming back to me. But sometimes you find that in this modern age, it's a bit different. But you're right. You are right. In that point, or at least in my experience, and that's not to knock any doctors who are younger or anything like that. But thank you, everyone, for your time, and thank you for logging onto this platform. And we really hope that you have either a good day, if it's still morning, a good evening, if it's evening, a good afternoon, if it's noon where you are. Oh, he was a young dentist. Okay. Sorry, Louise. I misunderstood your statement. But that's a very good young dentist.
Right. That's right. Always learning, always learning.
Yes, always learning, always learning. So I really hope that everybody just continues to take care of themselves, and that will basically come and join again next week on this platform, and to learn more about vitamin K in our bodies and the importance of it. Thank you again, Dr. Tramel, for your time. And thank you again, everyone else. I see we are still live on YouTube. Charlene, are we going to be dining off now?
Yes, I will do it right now.